Welcome to this webcast on hygiene, illness and injury management, a topic which is more important than ever to ensure that your education and care service is well prepared for those unexpected health and safety events. This webcast, which has been proudly funded by Lottery West under its risk management initiative. Since the pandemic, many organisations like yours have realised the importance to have preventative measures put in place and have plans to deal with the unexpected events. Child Australia has produced these webcasts, of which there are 3, to support not-for-profit services. Child Australia is a not-for-profit organisation itself, and we've been providing quality initiatives and services to professionals, parents and children. Our services range from professional development and online learning tools to programs for parents and early learning care for children. We are an organisation dedicated to improving developmental outcomes for all children. My name's Hans.
My name is Amanda, and we shall be your webcast presenters. There is a set of resources that accompany this webcast. You can find these underneath the recording in the section titled Resources. We acknowledge the traditional custodians of the lands in which we are recording this webcast today, the Whadjuk people of the Noongar Nation. We also want to acknowledge the traditional custodians of the lands on which you are learning from today. We pay our respects to elders past and present.
This webcast has been designed to assist the preparedness to ensure that we all keep children, families, staff and stakeholders of our services safe. And the webcast is designed to help those working in or supporting not-for-profit services in maintaining a healthy environment and preventing the spread of infection. So what we're going to do is cover how to best prepare for health incidents in your service, as well as how to break the chain of infection. We will also look at an overall risk management and risk assessment approach that will help to revise procedures that you have in place.
The term hygiene refers to the practices that maintain health and prevent disease, especially through cleanliness. Though many adults have excellent personal hygiene, working with many children each day requires a much greater focus. The reason for this is that children interact with each other closely and are still learning about personal hygiene. Children rely on adults to role model this and to help keep them healthy and safe. In education and care services, because of the large number of children attending each day, the potential for germs to spread is very high. With heightened awareness of hygiene due to the pandemic, we will cover the best practice methods to ensure that your service is effective in breaking that chain of infection to keep everybody safe.
People usually pick up germs from others, also from contaminated food, an animal, or from the environment. We term these the source. Germs spread from the source in several ways. For example, through the air by droplets, and that's by coughing or by sneezing, talking or even spitting, or contact with feces or other bodily fluids. Germs can reach the next person through broken skin, the mouth, nose, eyes, or genital areas. People with a weaker immune system may not be able to fight off those germs and therefore have a really high probability to become unwell. Germs cause infections and can also exist in the environment. So there's lots of surfaces like the tabletop or the bench where germs live and can be easily transmitted by touch. The process of infection is called the chain of infection, but it can be broken by having appropriate hygiene practices in place. And that includes hand washing and cleanliness of areas. These practices that maintain health and prevent disease, we call hygiene. Hygiene plays a crucial part, as you know, in education and care services. We have a number of hygiene practices such as hand washing, cleaning, immunisation, also the exclusion that we have in place due to illness, the nappy changing procedures and ways to handle bodily fluids, as well as food safety to think about and comply with.
There are 4 types of germs: bacteria, viruses, fungi and protozoa. Bacteria are all around us. They are microscopic organisms which you cannot see. There are bacteria which are good and even helpful. For example, bacteria that assist us with our digestion in our intestines. However, other bacteria are destructive and cause infection or disease. Viruses, on the other hand, are even smaller than bacteria and cannot survive without living within a cell. Viruses are hard to treat as they infect each person differently. Viruses can also morph into different strains amongst people, as seen with COVID-19. The common cold, chickenpox, measles, and influenza are also viruses. Fungi are a variety of organisms that include yeast, molds, and mushrooms, living in a damp environment. Many fungi are safe to ingest, but some can cause disease, for example, ringworm and thrush. Protozoa are microscopic organisms that thrive in moisture and often spread illness through water. Protozoa may cause intestinal infections, which can lead to stomach upsets and illness.
Our hands are a prime vehicle for transmission of germs, so it's no surprise that most diseases are spread through really poor hygiene practices. This is usually because people are constantly touching surfaces, then touching their faces. We also cough or sneeze onto our hands, and then we touch other surfaces around us, like we talked about earlier, the tabletops, or we touch toys, door handles, and the list goes on. So any surface we touch is a place where germs can be transmitted. The germs transfer onto that object, then another person comes along and touches that surface, then they also touch their face. And then that makes a really easy way for germs to find a clear path into someone's body. Young children are always in close contact with others. They're always playing close to each other. You often see them putting their hands in their mouths, and they're still to master the appropriate etiquette of sneezing or coughing into their elbows, which is why the importance of hand washing and hand hygiene need to be made to children to prevent infection amongst them. And it's the most effective ways to prevent these infections.
Educators should ensure role modelling of hand washing processes, explaining as they wash their own hands and monitoring children's hygiene practices. Ensuring routines of hand washing before meals and providing hand sanitizer can also assist this practice. It is highly recommended that you wash your hands regularly with soap and water, or, if not able to, use an alcohol-based sanitizer product that doesn't require water. This is the single most effective way of killing a transmittable virus. Either of these methods is effective, with many varying products available at supermarkets and pharmacies. It is critical that hands are washed after using the toilet, after coughing, sneezing, blowing your nose, after being in contact with someone who has the virus, before touching your eyes, nose, or mouth, and before preparing food and eating. Where possible, you should wash your hands with running water and liquid soap. Each hand wash should take at least 20 seconds, which is about the amount of time it takes to sing happy birthday twice. Basic hand washing steps are: turn the tap on, dispense soap and rub over every part of your hands, back and front of hands, between fingers, under nails, and under any jewellery worn.
In education care services, PPE or personal protective equipment is always used to protect educators from bodily fluids such as mucus, saliva, vomit, feces, urine and blood. Some educators in services also wear aprons, gloves and face masks when required to protect themselves as well as the children they care for. We use hair nets when working in the kitchen. Wearing gloves is an important barrier to germs. However, it doesn't actually eliminate the risk entirely. It doesn't replace hand washing. So educators are required to wash their hands before and after wearing gloves, and must change gloves between each child or each activity. Gloves should be worn on each hand. Avoid using latex disposable gloves, as they're a known allergen. Educators are encouraged to wear gloves when changing nappies, when helping children dressed after a toileting accident, or when cleaning up a toileting accident, when cleaning up bodily fluids, when cleaning, but consider more durable utility gloves, as some gloves are quite weak to do heavy cleaning. Now, if a pandemic becomes widespread in the community, authorities may encourage people who are sick to wear a mask or other type of covering for the nose and mouth to help protect them from catching a virus. It's particularly important for people who are sneezing or coughing to wear a mask, if possible, to prevent the spread of their infection to others. Another idea you may want to take is a proactive way to stop the spread of infection by visitors to your service. So providing tissues and no-touch bins, soap or alcohol-based products and sanitizers for your visitors and clients, posting up some signs to remind people about good hygiene practice are all good ways to stop the spread of infection. Posters and information brochures can be downloaded from the Health Department website to help educate your other stakeholders in your service.
Cleaning with warm soapy water is recommended by staying healthy in childcare. We should start with the cleanest areas and move to the higher soiled areas. Cloths and mop heads, once used, should be washed in the washing machine with hot water and hung in the sun to dry. Cleaning equipment should be kept in good condition. Cloths for cleaning should be colour-coded according to their use. For example, blue cloths for cleaning art tables, red cloths for cleaning kitchen benches, yellow for dishes, and so on. Service should give thought to other cleaning products used, like disinfectant, as well. They need to be effective whilst also environmentally friendly and safe to use in areas where children play. Remember that people are always making contact with surfaces and may have adverse reactions to strong chemicals. If bleach or disinfectant is used, dilution instructions should be followed. These will be found on the product. Toys and resources should be cleaned regularly. A cleaning schedule should be created and adhered to. Toys that have been in a child's mouth should be removed from the play area and washed immediately or put in a bucket to be cleaned where time allows. Checklists and rosters are essential for keeping track of cleaning tasks and ensuring that they are completed as required.
Your hands should always be washed and dried thoroughly prior to handling any food. While in the kitchen, personal protective equipment like an apron and a hairnet should be worn. Now, gloves aren't necessary when preparing food as long as you've washed and dried your hands correctly. The food area should always have a sink specifically for hand washing. Now, food in education and care settings are required to be kept hot at more than 60 degrees Celsius or cold at 5 degrees or less. If food needs to be reheated, it may be done only once and must be hotter than that 60 degrees. So make sure that the kitchen has the correct thermometers to regulate these temperatures. Kitchen areas in education and care services will be put through an annual audit or on some other regular basis. This ensures that the areas are clean and hygienic, that also the appliances are in good repair, and that storage of food is at the right temperatures. So ensuring food is stored carefully in the fridge avoids cross-contamination. For example, raw and cooked foods must be stored separately. Put the cooked food on the higher shelf and raw on the lower shelf. And make sure you're monitoring that temperature of the fridges to ensure safe storage. Cutting boards and knives should be used for preparing separate foods. For example, meat should be cut with the blue-handled knife on the blue cutting board, while you might have vegetables and fruit with a red knife and a red cutting board. So separate knives should be also used for cutting raw and cooked foods.
Further details on hygiene can be found in Staying Healthy resource by the National Health and Medical Research Council, specifically created for education and care services. We have provided a downloadable copy in the resource area of this webcast. The pandemic is supported by a number of government departments. The Federal Health Department has fact sheets, data, updates and advice. The local West Australian government provides COVID safety plan templates and other resources that you should consider. The escalation of infection can have drastic effects, and being prepared is your best tactic, using effective preventative measures. Written policies and procedures assist compliance, but also enables a source document for reflection and further improvement. Child Australia has a webcast on methods to approach policies and procedures for your service. They're available through our website.
Whenever you have an ill child in your service, try to separate them from other children to stop the spread of infection. If a child is not well enough to participate in activities, contact their parent to send them home. A child who's feeling unwell really requires a person to care for them. This is usually a parent or grandparent. So while waiting for that parent to arrive, keep the child away from the main group of children where possible. A way to do this could be to have them lie on a floor cushion or mat in the corner of the room where you can still comfort and supervise them. Once the unwell child leaves, ensure that the mattress or floor cushion they've used is clean before it's used again. Some infectious agents, we know, can persist on surfaces and may support the chain of infection. So just because something looks clean does not mean it does not house bacteria. They're invisible.
Childcare regulations require exclusion of children and employees from the centre whilst infectious with significant acute illness. Children with mild illnesses, for example the common cold, or with chronic infections such as HIV, hepatitis B or CMV infections are generally not excluded. Exclusion policies are time-honoured and effective, but have several drawbacks. Parents may have difficulty in finding alternative care for mildly unwell children, so it's important that exclusions due to illness is covered at the point of enrolment. The Staying Healthy resource includes the most common illnesses, with details on how to identify them as well as exclusion periods. This is useful information to inform parents and other stakeholders whenever you are in doubt of a child's condition. Follow your service's illness policy and inform the child's parents, carers as soon as possible.
Assessing risk considers the probability of the risk and the impact of any risk. Many of the injuries in education and care can be prevented with the right controls and training in place. So this risk assessment table can be applied in a number of circumstances, such as the risk to staff when they're lifting heavy objects, or risks to children climbing the fort in the outdoor playground. In another way, we use risk assessment for an excursion for a group of children to the zoo. And if we use that risk assessment matrix, we'd find risks in the transporting methods, also risks in being around public spaces, as well as the health and safety risks of children if the case is the lunch is being catered for. Using the risk assessment provided by a CEQA, where we work through the circumstance of early childhood educators who only have access to child-sized chairs as an example of the evaluation of risk of injury and what actions need to be taken. So this is the risk assessment and management tool that's available via the Australian Children's Education Care Quality Authority. It can be used in a number of different circumstances. If you visit their website under resources and templates, you'll find a copy there. What we love about this tool is it actually goes through the whole process of the risk management cycle, the risk matrix, but it also includes certain risk assessment templates for excursions, for transporting children, and also talks about the risk matrix to work out whether it's likely or not for a hazard to become something of harm. So what we're going to do now is just show you this document. You've got some reflective questions and background information that you can actually use to help train staff. There's the key terms and so forth. I'm just going to scroll through. There's even a supervision focus on how to reflect upon the risks in supervision. It has some excerpts from the quality guide as well. But what I really like here is the risk management cycle. So what we're doing here, we're talking about documenting the process by identifying the hazard, assessing the risk, and then working out how we can manage it. And just a bit about the risk matrix. Across the top there, to work out the severity of our risk, we look at the likelihood from rare, which is very unlikely on the right there, up to almost certain. So how do you work these out? Well, it's a discussion with staff or the team or the management committee. And then what you do is work out what is the consequence. So how significant will be the outcome of this possible or likely risk or almost certain risk? So we're going to look at now an example that we're going to work through.
as part of this webcast. Now, we're going to be discussing when educators use child-sized chairs. So we've identified the actual risk in our team, and if we look at this guide on the risk assessment and management tool, you can see that it's a biological hazard. It's going to affect the way that people are. So it's actually an effect on the human being itself. There's also a list here of different other types of hazards that can help you along the way to identify other types of hazards. Now, it also talks about the hierarchy of control here on the right, the elimination, isolation, or engineering and administrative controls. So we'll have a look at here and scroll down past excursions, transporting children is another template. And for the case of looking at a chair, we're just going to use a generic uh, document about a learning experience to show you the example. So here we go. This is a learning experience, can be used by educators as well for risky activities, but we're using staff, the situation where staff are using child chairs. So the overview of the experience, the overall of the situation, you can see it in green here, is that we usually use the chairs when we're attending training at the service. It's after hours, and those sessions go for 2 hours. We also use the chairs when children are putting on the sunscreen, so we help them by sitting at their level. We also use these chairs when working on quality area one of the device in the room. So it's not a rationale links to children's outcomes on the right there, but if we're doing a learning experience, we look at the risk benefit side of that. Um, who uses these child chairs? Well, usually it's the staff, adult visitors, or lecturers and trainers that may visit us. The experience is happening in the room, so we step by this template form. You can adopt this in your service. Nothing about what children are doing because we're talking about staff, but of course this would be used in an experience. But here we're talking about child-sized chairs and tables is what our team have seen a concern for. So identify the hazard. The team have discussed this, and we've just found out that really the hazards are muscle strain. If the cases were sitting in small chairs, we're not supporting our backs too well. We're crouched up with our knees high. So there's also a risk of injury to your knees when getting up from a low stage of those child seats. But also when we're getting up, obviously those seats are too small, it's quite awkward, and it's possible, quite likely, that we'll injure our ankles. So that's where assess the risks of these hazards. So the hazards of muscle strain or injury to ourselves. And we see here that if we look at our risk matrix and we think about the certainty and what the impact could be, muscle strain, it's almost certain to happen. We use those chairs very often. Injury to knees, it's likely. So how do we do that? Well, if you scroll further down past here, you'll see the risk matrix. So we've looked at it and said, from a rare to almost certain likelihood, in terms of using the chairs and having a back injury, we are looking at it as almost certain. So when we scroll up to what we're going to do, we know that it's quite severe. There's a chance, quite a major one, so the impact is quite big. It's critical if someone actually puts their back out, and we know that we use those chairs. So we've got to do something. It's urgent. What are we going to do? Well, we're going to look at the administrative controls. We're going to train all staff on the awareness of back injury prevention, but also we're going to change the way we use those chairs. We're only to use the child chairs if we're going to be less than 10 minutes in that chair. And the other better way to do it is probably to substitute. So replace some of those child-sized chairs with adult-sized chairs. So we can still have the child-sized chairs around to be used at very short times. But when we're working on quality area one of the device in the room, maybe what we're going to do here is use the staff room. So the staff room has the large desks, and that's what we're going to use instead of being in the room. So what we'll do is say, when with a device, we're going to take out this, and we're going to say, use the staff room. And then the idea is to come back and revisit this, and that's where it says at the conclusion of this experience. So we need to review, and just like the acronym of safety, SAM, we need to manage the risk and monitor. So this is where we monitor it. So it's a great tool. Make sure to download it, and that's how we use a risk assessment template provided by SQL.
WorkSafe Smart Move is a Work Health and Safety, or WHS, online educational program for those entering the workforce or on work placement, which is useful for those during practical components of any training. We suggest that educators do this as a minimum to prevent them from harm or hazard in your service. The acronym SAM helps to recall the approach for staff. S for spot the hazard. Identify hazards in the workplace, formally or casually, but take action. A for assess the risk. How likely is it for a worker to be hurt? How badly could someone be hurt? How immediate is the danger? M for make changes. What can be done to fix the hazard? How can we minimise the danger? Who do we tell? And lastly, M for monitor and follow up. This ensures the SAM cycle keeps going, so make sure to follow up those concerns to make sure any changes are successful.
In early childhood workplaces, most of the injuries we experience are musculoskeletal. That means sprains, strains, fractures and soft tissue injuries. These are experienced by educators and caused by the everyday activities that educators do, like moving the play equipment, lifting children, as well as sitting on those small chairs. Here are some ways we can prevent these injuries from happening in the first place. So when you think about storing or moving items, store the items between mid-thigh and shoulder height to prevent overreaching. Avoid storing unstable items in a box. Surround these loose items with packing material so they don't shift around in the box. Make sure there's enough space in your storerooms to efficiently move about and handle items. Make available the right equipment to move heavier, bulkier items like a trolley or a stool. Now, when we're thinking about assisting children, make sure to use safe lifting techniques. You need to consider specific training in safe lifting techniques to avoid things like the twist. Also consider training for manual handling and how to use the equipment and aids that you've provided. Also, you need to make sure that the service has safe procedures in place that are understood. So you need to provide the right training. When assisting children, those steps and stools are really important, and also make use of these to educate children in the difference between safe and unsafe. Make sure all the toys, devices and equipment are always in good working order. Check the floor surfaces. Wet floors, thick carpets, rugs and uneven surfaces always increase the risk of injury, especially for trips and falls. Not only for educators but for children as well. Child Australia has a webcast on work health safety which covers in detail these techniques. So visit our website for more information.
Checklists and audits are important in the ongoing monitoring of services. As a reminder for staff, ASEQA contains several guiding resources which are available via their website. These should be included in your ongoing review of processes. It is very important to communicate openly with anyone involved in an injury matter. Consider the people to contact and make sure to offer support. Without clear communication on injury matters, situations can escalate quickly. Preventative training and having the right equipment in a safe environment for the job helps to create a culture of safety. We recommend that you keep informed with work health and safety, particularly with any changes to the law in 2022, by visiting the WorkSafe website and the Health Department.
There are a number of notification requirements under national law for education and care. There is a requirement to notify within 24 hours those serious incidents, injuries or trauma of children while educated, or when there's need for medical advice or emergency services. You also need to report within 24 hours for unaccounted children, missing children, locked out or locked in children, and you need to report to the authority. We always suggest not to wait until 24 hours. It's important that as an approved provider, you have awareness of the issue as soon as possible and you make contact to the parent and carer of the child as soon as possible. The longer the time that you leave between notifying the authority and the incident, the greater the risk. We need to focus on the needs of the children rather than those of the service. Any complaints that allege a serious incident must also be reported to the regulatory body within 24 hours. Where a circumstance arises that there is an identified risk to children, the notification period is within 7 days under Section 175 and 176. So if you are a nominated supervisor or you're a committee member or the committee that's the approved provider, you need to understand fully all the notification requirements. A great summary can be found in the ASEQA Guide to the National Quality Framework.
That ends this webcast on hygiene, illness and injury management, brought to you by Child Australia and funded by Lottery West. This is the one of 3 in the Education and Care Effective Governance for Not-for-Profits series of webcasts. Today we looked at the breaking of the chain of infection with effective hand washing techniques, making sure that educators are role modelling these to children. We looked at how we can break that chain with cleanliness of surfaces, as well as ensuring that when serving food and drink that we keep the right temperatures and have the right equipment within our kitchens. We looked at illness management using the Staying Healthy in Childcare resource, so make sure to download a copy. We looked at the ASEQA risk assessment template to actually look at how we can better manage hazards and make sure we protect people from harm. Please check the Child Australia website for further details on policies and procedures and risk management, which were mentioned in this webcast. Again, we'd like to thank Lottery West for its commitment in funding, and also thank you for joining us. We hope to see you next time.